I love being a prescribing dietitian because of the extended skills that I learnt on the course and the extra autonomy it gives me in my role.
Prescribing gives you a lot of insights about pharmacology, and it means that you can communicate effectively with doctors, patients about medications. It offers you a position of trust, and it means that you can really have it's the advanced practice really that I provide you with that I think is brilliant.
I took an unusual route into dietetics. I did a pharmacology degree before I became a dietitian, so I've always, from the moment I qualified as a dietitian, seen that there's a requirement of having good knowledge of drugs in order to help our patients, and I worked in a very generic community role, seeing pretty much everything, so I really appreciated that. So when the opportunity came up, I thought it was a really good chance to actually formally have a qualification which would allow me to use that knowledge again and actually just support the patients with better care, because quite often the patients you're seeing involve medication management as well as dietary management.
I actually see my patients, I talk to them, I get their food history, and I understand how the food they eat actually affects certain part of their treatment in terms of chronic kidney disease, and I understand the medications they need to take, how much medications, depending on what type of food they eat. And since I'm the one who asks the questions around food, no other person within the MDT, I think I'm well placed, and my patients actually love talking to me about those things. So it's just a win-win for the patient and for the whole MDT at large.
It enables me to work more closely with my colleagues, providing safe, effective care and really going in depth in their medicines management, but also from a dietetic point of view, bearing in mind their nutrition obviously alongside it.
I love the completeness of care we can deliver to the patient. So now I can assess, diagnose, and investigate and actually prescribe to my patient, and that complements the nutritional advice I can give really nicely.
I've been working with people with kidney disease for many years, educating about medicines for lots of years and not being able to address medicines management myself. So to be able to prescribe them myself is really exciting.
The main drugs that I did my prescribing to do is the GLP-1s, the Wegovy and tirzepatide or Manjaro. I'm really excited because there's so much out there now about the benefit of these drugs in cardiovascular disease, obesity, diabetes. Very excited to get the funding to start prescribing these drugs.
The thing that I love about being a prescribing dietitian is being able to take legal responsibility for my decision making. Prior to supplementary prescribing, I work with patients with intestinal failure who need intravenous nutrition. So I would do a thorough nutritional assessment, I would estimate the patient's energy, nitrogen, electrolyte and fluid requirements, I would write out the prescription, and then I would take it to one of the doctors and ask them to sign it for me. That doctor may not have had they haven't done that assessment, they may not have any understanding of how I came to get those numbers. So for me, it's about really taking responsibility for your own clinical decisions.
I love that I can take legal responsibility for the suggestions that I'm making to medications, particularly like parenteral nutrition. So I'll assess the patient, I'll estimate their requirements, and then I'll come up with a parenteral nutrition prescription. Previously, a doctor would sign that who might not have assessed the patient or not even really understand what is in that parenteral nutrition bag. Whereas now I can sign that prescription and take that accountability and that responsibility of that prescription for that patient.
The thing I love most is being able to give better patient care and being able to improve patients' access to medicines in a more timely manner, and just the positive feedback I get from patients and taking out some of the middleman in terms of before I used to have to ask doctors to do something and then wait for that prescription to happen. So it's just being able to give better patient care.
I love the positive feedback I get from patients when I'm able to bring their diet and their medication management strategies together. The fact that we can talk about things all together, they're just very happy that they don't have to go elsewhere to talk about medicines.